Everyone, welcome to Our Disabled Future, a series where disabled voices lead the way. I'm your host, Nico, and it is a good day for disability inclusion. Each day, during Disability Pride Month and beyond, I'm amplifying real disabled stories. Where we are, where we want to go, and how the heck we're going to get there. Together, I hope. Today, I'm thrilled to be joined by Bianca. Let's dive in. Hi, Bianca. Thank you for joining me. How are you doing?
Hi, Nico. Thank you for having me today. I'm doing well, thank you.
Of
I
course.
am Bianca. I am from Romania. I was born with spastic tetraparesis, which is the most severe form of cerebral palsy. I was born, my diagnostic is because I was born at 6 months, and while I was born, I had a lack of oxygen for a few minutes, and that led to disruption in my brain, which lead to my diagnostics. I am also a clinical psychologist in Romania, and I'm working with psychological tests where I test people with neurological condition for their cognition and well-being. I am also a part of the International Disability Alliance as an advisor for assistive technology. Because I use a lot of them in my daily life, especially I use the uh, assisted devices in my shower, and I use the wheelchair a lot together with different aids to assist me in walking because I can't walk alone. I also wear hearing aids, but I cannot tell if my lack of hearing is because of my diagnostic or it was just a bonus that I get during my life, but I can tell for sure that my deafness came also after I was born, so it was not acquired in my lifetime later on. Uh, I do physical therapy since I was 6 months, 3 times a week, so it's a lot of hard training, which requires a lot of determination and consistency in doing the treatments. A lot of people ask me when they hear about my diagnostic if I use medication specifically to target to manage my spasm, and the answer is no. For those who want to know, I use mostly painkillers like Nurofen or ibuprofen, what helps most, but nothing stronger than that. I I think the biggest challenge with this diagnostic is the pain that I have because it's not really related only to the spasm. But for example, I have the most pain while I'm eating because my facial mask get spastic while I chew. And also my stomach during digestion process have to digest my food, so the spasm caused by digestions are really hard to manage. And what I also find very hard to cope with is the changes in uh, temperature, but I mean mostly like if we go from 30 degrees to 20 degrees, or if we go in the summer from 30 or 25 degrees to 34 degrees in 1 or 2 days, it really increases the general spasm in my body, and this can be quite painful. Uh, Also, a challenge in my life is finding the right job for me because it's very hard to manage between what I want, what is accessible, and what I can do. Because in Romania and maybe in other countries, but because I'm from Romania, I'm gonna stick to that. The places aren't very accessible. Like uh, from going in the building to inside the building. And beside this problem, what is generally called small, because the bigger problem is that I need an assistant because I can't use my hands to push the wheelchair because of the spasticity in my hands. And generally, having an assistant with you is always a problem during the interview because if you assess patients, patients want privacy. And if I need someone to help me with the papers or to give me certain things that I need, this has been a problem, which was the cause why I was rejected so many times because having an assistant it's seen as a lack of confidentiality. And this is another story to tell. And also, because of my hearing, although I wear hearing aids, the outside noise, which I hear like air or the wind or the echo, for example, in the summer, blues everything I hear. So the building or the place where I for me to hear good needs to be soundproof, which is I don't think I know 3 places in the city I live which are soundproof. Maybe one, which is also hard when you decide to apply for a job or even to go to hang out with your friends. Imagine that I want to hang out and I have to tell them, no, I can't make it because the place is not soundproof. It's really that kind of things that makes us feel even more excluded from the society. Um, I hope that uh, our society in Romania at least will get at least more accessible to go out, but also more the mentality of the people to change, to see us as human beings and not necessarily as a patient who needs care all the time. Because it has happened to me not only with people I encounter, but also with my patients when I began my career 5 years ago. And it was like they asked, how can you provide me care or help me psychological in a problem that I need if you need help all the time? But those are two different things that people, at least in Romania, don't seem to understand. That being having a disability, no matter that we call it spastic tetraparesis or any other name, it's strictly personal, and a professional life it's another story that does not need to be affected or have an impact on your professional skills. I hope this makes sense for everyone who's listening. And due to that, and I also have seen a lack of knowledge in the world of doctors and physical therapists, also in the Netherlands, not only here because I studied in the Netherlands. For my bachelor and my master's, is they tend to look only on the how do I say symptoms on the outside of the body, like an increased spasm or lack of movement or lack of flexibility. But what they forget to look at, or they don't think about it, is the muscle by the stomach or muscle by the chest or muscles uh, in your face that also those, if they get spastic, they can inflict your life in a worse quality of life. And now to give a small example, while I was a student, I happened to lose my voice twice. First time in my life after seven, I think I was 20 by then. After 20 years, when I never lost my voice, I happened to lose my voice in 2 months. And I couldn't talk at all. And I had to speak through with my hands, kind of. but I don't know sign language, so I got to speak just, I hope the person in front of me understood. And after I returned to Romania, because I was in Holland at that time, I started physical therapy again with my physical therapist in Romania. And after 3 weeks, I remember it took very long and I was very scared. I regained my voice. And after a careful examination, the physical therapist has told me by then that the lack of physical therapy in the facial mask and in my neck, which is connected to my shoulder, so the entire area was so spastic that in the end you lose your voice because the masker you can't use anymore your masker to speak. So that's why I want to highlight this important part because maybe someone else has the same problem and they don't think about it. Uh, Connected to that story, I also wrote a book because of this struggle and many more, which can be found in the book, which I published together with a physical therapist I worked with. And it gives exactly this kind of examples in the real life. It's called a spastic patient perspective on spastic tetraparesis, especially able. Uh, and it's published by Cambridge scholars in England. And I'm thankful for them to believing in the success of the book and to help me write in it and give the final form that it has now. And I also want to highlight the difficulty to make friends, not only because they don't understand the diagnostics, because it can happen that it's simply lack of knowledge, but it can also happen that uh, when I refuse to meet someone or I prefer to go remote because it's the lack of accessibility of that place is not suitable for me. They don't understand somehow that it's the lack of accessibility and not the not wanting will to meet them, which makes you, when they don't understand this point, you feel even more excluded and more socially unaccepted or integrated in the society because remote can do so much, but we also I want, and I believe other people want human connection. And human connection is also important beside making friends for our growth and our well-being. So to people out there who have a friend with this diagnostic, before you take a no, think about or ask the person itself why they say no, because it can be simply a lack of accessibility or other things that they find important and not the will of not wanting to meet you. Uh, and lastly, I will tell people with this diagnostic to enjoy life because it's hard, it's painful, it's gives sleepless nights from the pain or from other stuff. And it's important for us to enjoy the little things, like that we have a good day, that we had a good sleep, that we manage to wake up and do an activity we enjoy. Because those things give us the meaning to go forward and to surround ourselves with people that do not need 1,000 of explanation of who you are and why are you like that, but also to understand that by explaining maybe once, twice, 3 times, that this is enough for them to accept you for who you are. Because a diagnostic is not, it's a medical label. It's not who you are. It's not makes you your personality. It doesn't change who you are or who you become. It can influence how you grow from a physical point of view. You get tighter, you get looser, you get less spastic, more spastic. But who you are as a person, what you love, what you hate, uh, what you dislike or what you like, that doesn't change over time. That remains the same. And I would tell people who work with people like with this diagnostic, and I don't mean necessarily physical therapists or doctors, to give them a chance to speak for themselves because it happened to me a lot. The decision are made for me by the other people because they think they know better the diagnostic. But in the end, the person who knows the best this diagnostic is the patient. And one doctor asked me, "What if you can't speak?" And I said to him at that time, "Yeah, but I can blink. If I can speak, I can blink or move my head up, down, left, right, move my hands." So take any form of communication and let a person be uh, who they are, have a right to decide for themselves, and have a help them to have as much as independent life as they can have, despite their limitation, because limitation is only from here to here. The real limitation which I met in my life is the psychological one from the people around me. That's the real limitation what I face every day. So I'm back to Nico if he has any more questions.
Thanks, Bianca. That was very detailed. So I do have my typical 4 questions to ask, and that was just the first question. So my second question is, what does a disability-friendly future look like for you?
Disability-friendly future will be more accessibility, and by that I mean more places to be able to go to. I mean also accessible places to vote, because it's not accessible, and the right to vote is a vote that we should be able to do without having something that blocks us to do that. I also want to add accessibility to education without bullying, because even though that we go to school and we have the right for education officially on the paper, the bullying and the struggle during school, that was for me very hard to cope with. So education without bullying will be on the top of the list. And I believe also a friendly future will be where people look at our strengths and make us, help us, and make them stronger than be seen for our weaknesses.
Thank you, Bianca. You call for a future which increases accessibility across many sectors of society. How do you think we get there? How do we build that future that you just described?
How do we get there? Um, that's that's a hard question. Are you still there? Yeah. That's a hard question because most of the time we need a help from the society to make the places more accessible, and there we come back to funds and lack of money and rules, many rules to be followed. But I think uh, if that can be done, if through the rules we can't make it accessible, then it's up to the people that educate us or raise us or mentor us during our professional uh, uh, professional development to to help us to treat us equally, because education can be done also informal. And also, for example, if one of these people, one teacher, for example, speaks with the director of the school and say, we have a disabled child in the school. Let's make, I don't know, let's make a fund uh, from the class or from the school, and let's build something accessible that this person needs. So I think instead of going higher to reach our goals, we should start lower, because there we have the resources which are more closer to us, and then we have also the people that we can count on.
Well, thank you. I really appreciate the example that you gave. All right, Bianca, as our time together today draws to a close, I want to end by giving you a chance that you and I, as disabled people, rarely get. That is a chance to brag about yourself, promote something cool you've done recently, or maybe something you're currently working on. If you want to grow your presence online, social media, be an influencer, all that, where can people find you? But this is just open space for you to brag about yourself. Let's hear it.
Thank you, Nico. I will start by where people can find me. I am easy to find on LinkedIn, on Instagram. My full name is Bianca Maria Wiesma. I also use Facebook, so all these social platforms are open. To brag about myself, about something recent, something I've done. Well, I'm very proud of the book that I wrote. It took 3 years, and I was rejected by 5 publications before it got published. Yeah, it was a hard one. But I think what I like mostly of what I've done, I like extreme sports. Oh, I love them. So I've done bungee jumping, not from the mountain because I can break my back, and I really love my back. But the classical was used for safer situations. I fly with an airplane. I made a parachute jump. I did scuba diving, and I want to try paragliding, but I'm a little bit afraid of my physical and chemical knowledge. So I'm gonna leave that for later. And I really like uh, a day when I don't have pain. A day for me when I don't have pain and I sleep at least 6 hours without pain. This is quite an achievement for me, because generally I sleep less than 6 hours if I have pain. It's a good day for me.
Bianca, thank you so much. I really loved hearing about all the extreme sports that you enjoy. All right, folks, tune in next time. Remember, this is our disabled future, and we're building it one day at a time together. Wherever you go, whatever you do, I'm rooting for you, and I can't wait to see what you do next. Bye.